Hello everyone and welcome to Inside Healthcare. We begin with an in-depth look at what's being done to save the lives of new moms from one of the most common yet potentially deadly complications of childbirth. We're very pleased to have back with us Dr. Jed Gorlin with Memorial Blood Centers and Innovative Blood Resources. He is also on the National Council of Patient Safety in Women's Healthcare through its National Partnership of Maternity Safety. So Dr. Gorlin, glad to have you back with us.
Thanks for having us.
So maybe you can start off by what is the complication? And I understand that it's even on the rise. It's increasing in the United States and other countries.
So it's postpartum hemorrhage, which means bleeding after the baby is born. And it's the second leading cause of death from having a baby, from being pregnant in the United States. In many emerging world countries, it's the first and leading cause of death. In only 3 countries did the rate of maternal mortality increase from 1990 to 2010. That was Sudan, Afghanistan, and the United States.
Wow, why
is
that? Why is it increasing?
Sadly, for a number of reasons, but the single largest one is probably access to health care. Those prenatal visits are important. And whatever one thinks about Obamacare, it is important that we increase access, especially for poor and minority women. It's among minority women that some of the highest rates of maternal mortality exist.
I just didn't hear that. I wonder how many women have heard about that and know about that. So what causes this?
So many things. Often after the baby is born, the muscle is very tired and relaxed. And in order for the bleeding to stop, that muscle needs to tighten up. That's called atony. And there are things that clinicians can do to improve that muscle tone, either by massage or by medications. But it's important that it's done in a setting where people can recognize the seriousness of that complication. It's also a little hard to know how much blood you've lost unless you've measured it. So one of the efforts that's involved is to encourage the quantitation of blood loss following baby's delivery.
Seems like such a simple measure too. How does the national organization, in your role, how does this all involved with trying to prevent this problem from happening?
So we're very grateful to Merck for Mothers. Merck Pharmaceutical Corporation donated a lot of money through the nursing organization AWON, and we've worked with 2 states and the District of Columbia, New Jersey, Georgia, and District of Columbia, to try to increase hospital preparedness for these bleeding events. And part of the biggest thing to have is just to do drills to be prepared for these events. So when they do happen, you can act very quickly, because you often need to act very quickly, be able to have good communication between the transfusion service and the docs, so that people aren't allowed to bleed to the point where it's too late.
And a new study has been published, or research has been published recently that addresses this and how to prevent it. What were some of the things that you found out? So
it's essentially a 13-step process of all the things that hospitals should do in advance to make sure they're prepared. There's surgical techniques, there's pharmaceutical techniques, there's just having drills that include all of the different participants. Very often when clinicians do practice situations, they will do it within their own group, but they won't necessarily be communicating with other groups, the emergency room, the operating room, or the blood bank, and it's important to include all parts in your drill. Working as a team there. I read in the study too, like if every hospital, every birthing center did this, we could drastically reduce these complications. So obviously not every bad outcome can be prevented, but at least there's an organization in California, CMQCC, that analyzes each and every maternal death, and somewhere between 60 and 90% of the maternal deaths, in hindsight, could have been prevented or likely could have been mitigated had action been taken earlier. Obviously, things are always clearer in 20/20 hindsight, but that does tell you how much opportunity there is to improve. So if a woman's watching this who's pregnant, what should she know or her family know about before she delivers her baby? One, it's very important to have that good prenatal care and to have the people that are delivering you know you, so they know what's normal about you and when things aren't normal for you. That doesn't mean you can't have a baby at home, but if you are planning a home birth, you should have preparedness to know, great, if everything goes well, which it does the vast majority of the time, great. But if it doesn't go well, is there a preparedness plan? Is there a way of getting you to a place where you can have the proper care in a timely fashion?
And are there certain questions that they should be asking, like how do they know if their hospital birthing center are prepared for something like this?
Ask them if they have had a postpartum hemorrhage drill. Ask them if they've have processes and procedures in place to know what to do if they start bleeding a lot.
What else should women know about this?
Well, they should be aware of just how safe the blood supply is and not be scared if they do need a transfusion. Getting a bad infection from the blood is about the last thing they should be worrying about because we are so good at being able to screen blood. It's really quite safe now.
And as a blood donor, I'm well aware of the screening. I mean, it's very thorough and you should feel confident about it.
We ask lots of questions every time, but more importantly, we do lots of testing every time. And so even if it's a little annoying that the nurse asks you your name for the 5th time, that's their job, and you really, really want that proper identification. That's to keep you safe. They're not doing it to annoy you.
If someone wants to get more information about it, where would they look?
As far as
Or
postpartum hemorrhage,
yeah.
Both the doctors organization, ACOG, ACOG, and AWON, which is the nursing organization, AWHONN, are excellent sources of information. The Merck for Mothers Project, again, just look up Merck for Mothers postpartum hemorrhage. There's a lot of information there. And for donating blood, Memorial Blood Centers has lots of information on how and why it's important to donate, especially in these midsummer months when a lot of people are on vacation and it's a little harder to keep our shelves full.
It is. It's really important to remember that. Is it because more accidents are likely to happen during this time of the year, or?
Actually, blood is used reasonably constantly year-round at a trauma center like Hennepin County, where I also work. We obviously see more trauma. People are riding more motorcycles in the summer. But the challenge is a lot of the blood drives we would have at schools, colleges, businesses are very hard to do during people's peak vacation times.
So it's important to give if you can.
Blood is used constantly. Cancer doesn't take a vacation.
Well, this has been really good information, and we really appreciate you stopping by to tell us all about it. Thank you.
Thank you so much.
Good to have you back with us. And that